Let's focus on endodontic diagnostics. Endodontic findings can either be entered via the Quick Select function or through the single tooth view. On a regular checkup, you might test several teeth in a row with a cold and percussion test. The Quick Select function is a fast and easy way to enter these findings in one go. In some situations, like an emergency patient in pain, you focus more on a single tooth or a group of teeth that might give the patient pain. Full endodontic diagnostics require mostly three clinical tests: the cold test, for checking the tooth pulp, the percussion test, for testing the periapical tissues, and an X-ray of the tooth under investigation. To make your life easier, we made derec so smart that it'll suggest the endodontic diagnostic of a specific tooth to you. This is based on the entries you perform on these three tests. Let me show you how this works. Let's assume that Buck comes to your clinic with pain in the lower right jaw. After a thorough anamnesis, you'll check the teeth in this quadrant. On tooth 4-6 you perform the cold test. Buck will jump on your dentist chair and reports that the tooth is very painful, even after you remove the cold from that tooth. Ouch! Then you perform the percussion test. Tap tap, ouch! On the X-ray, you see that the tooth 4-6 has no periapical translucency around the root apices. Let's record all these findings in the single tooth view. Go to tooth 4-6. For entering the periapical findings, go to Pathology, select Apical. Choose No, since the tooth 4-6 shows no periapical translucency on the X-ray. Select the cold test. Select Positive, then Pain Lingering. Select Percussion test. Select Painful. After entering all these three test results, derec will pop up with a diagnostic suggestion of that tooth. In Buck's case, irreversible pulpitis with symptomatic apical periodontitis on tooth 4-6. When you agree with the suggested diagnosis, derec will mark the pulp as A, to do. The pulp turns red. In the chart view, you will see the test results through the changing endo icons. A snowflake tells you that the tooth is painful on cold, the percussion symbol tells you that the tooth is painful to percussion. Next step would be that you will perform a pulpotomy or a root canal treatment. Next time Buck will come to your dental office you will perform the endo tests again. To change the status of the tooth, go to the single tooth view. Select the cold test. Since we either performed a pulpotomy or a root canal treatment, the cold test is not applicable anymore. Select Not Applicable and choose from the two options. Let's select Existing Root Canal Treatment. Since last time, the tooth 4-6 is not painful on percussion. Go to the percussion test, select Not Painful. The diagnosis of tooth 4-6 has changed from irreversible pulpitis with symptomatic apical periodontitis to previously root canal treated tooth 4-6 with normal periapical tissues. Also note that the endo icons have disappeared in the chart view. Plus, the tooth 4-6 is now listed as a to observe item, since we have to check the tooth after 12 months.